So thank you all for joining us for our summer education series. I'm Teresa Spellman, the president of HDSA Greater New York City chapter. And we're here to support our local community. So over the course of the summer, we have been hosting these sessions with Columbia University's HDSA Center of Excellence in New York City. We encourage you to submit your questions ahead of time. We have one more session ahead of this one when you register and visit our social media pages at HDSA NY. For the presentation today, we're going to encourage you to ask questions via the anonymous chat, and I'll field those questions towards the end of the presentation along with any that have come in ahead of time. Before we begin, just want to mention a couple of items from the team at Columbia that the HDSA Center of Excellence at Columbia University would like you to know they're open for telehealth visits by appointment most Fridays and in person for new patients now. And the Center of Excellence is open for clinical trials on site. If you have any questions about any of the studies, please contact Paula Wasserman at 212-305-4597. Now I'd like to introduce our speaker for today. Jill Goldman, who you see on the screen, is a genetic counselor who specializes in hereditary neurological diseases such as Huntington's disease, Alzheimer's disease, frontotemporal dementia, and Parkinson's disease. She is a professor of genetic counseling in neurology at Columbia University and serves as a mentor to the next generation of master's level genetic counseling students, a field that only continues to grow. She operates the genetic testing and counseling program at Centers of Excellence for Alzheimer's disease and Huntington's disease at Columbia University. She has authored many papers and edited a textbook on genetic counseling for adult neurodegenerative diseases, including HD. She also leads 2 support groups, one for caregivers of people with FTD, and the other for people living with early stage dementia. She also created and coordinates a unique program called A Friend for Rachel, in which pre-medical students visit the homes of and befriend patients with early to moderate dementia. And a note from Paula that Jill is possibly the most fit person on the COE team at Columbia, which makes her admission that she eats ice cream every night incredibly irritating. She says she must have 2 stomachs, one just for ice cream and one for everything else. I don't know about that, but here she is. Jill, turning it over to you.
Thank you, Teresa, and thank you, Paula. I must also say that my daughter is in the ice cream business, but she did that because she grew up with me, not vice versa. Anyway, I am thrilled to be here today. I think this is a really, really important topic for everyone to think about if they are thinking about genetic testing. And I am delighted that we'll have the opportunity to address some questions that you all have. So a couple of really important things to think about before we get into more specific questions. The decision to test or not to test is definitely an individual decision. Lots of people feel pressure from parents, from their siblings, from their children, and even from doctors. And that pressure should not be the determinant of whether you test or not test. Trust yourselves. There is no right or wrong decision, but I am really pushing that you consider doing pre and post-test genetic counseling before doing your testing and after doing your testing when you get your result. Because if you just go to your doctor really may not be experienced with genetic counseling and genetic testing. And there's just too much to think about before testing. And lastly, please ask yourself the key questions that we're going to talk about today and ask your counselor any other questions that you have. So a couple other things I want you to keep in mind. Number one, everybody is different and their experience with HD is different. And that comes into play when people think about their relatives with the disease, and that may be their only experience with HD. And the natural thing to say is, if I get this disease, I'm going to be just like my parent. And that is not true. You're a different individual to start with. Your genetics is different because you're half the other parent as well. And certainly your experience is different. And please remember all of that. So if you're going to test, go into testing with your eyes wide open. Think about all the things that we're going to talk about, and then really sit down and contemplate the decision carefully. One other thing I should say is you can go to genetic counseling and decide not to go through testing or to delay testing. And that is just fine, and lots of people do it. Okay. Okay, so the first thing to consider, and one of the first questions that I ask is, what's your motivation for testing? Why are you testing now? Why not in 5 years? Why not 5 years ago? So most people, when they're coming in to test, do it for one of these 4 reasons. Either reproductive options. So would you consider having children if you tested positive? If so, how would you have children? Would you use an egg donor or a sperm donor? Would you adopt? Would you do IVF with pre-implantation genetic diagnosis? Or would you just go ahead and have children the old-fashioned way? All of those choices are okay, but many people feel strongly about knowing their status before they think about having children. What about life planning? So, many people would say, well, I don't like my job. I want to retire early. I want to switch. But if I'm positive or I'm negative, that's going to influence what I do. Or I'm thinking about going back to school for a PhD, but why spend all the time and money if I'm positive? So that is often something I hear. A good many people just want to end the uncertainty that they have been feeling most of their life. They feel that it would be better for them to know than not to know, even if the result is different than what they really want. And lastly, this is a new reason that people are coming forward for testing, and that is to prepare for the drug trials that have already started for symptomatic people, but will eventually get to asymptomatic people. Okay, so those are the motivations, but what should you think about before you decide? So I ask people to imagine what it might be like to be in my office at the time that they're getting the result and hear, I'm sorry, but you've tested positive. You will develop HD. How would you react to that? How would you react immediately over the short term? And how would you be able to cope with this news over a longer term? Is it going to affect how you live your life? Is it going to affect your relationships, either with your partner, with your siblings, with your parents? Those are important questions. And then you have to really be honest with yourself and say, if the answer is no, it's not going to make my life better, it's going to make my life worse, or I'm really unsure how I'm going to react, then the time for testing may not be appropriate. Perhaps you should put it off and think about it some more. We often think about positive results, meaning that you're going to develop HD. But what about a negative result? Some people assume that they're going to be positive, and when they are negative, they actually react very poorly. They feel survivor guilt. Perhaps one of their other siblings has tested positive, and here they are negative. Perhaps their identity is really built around carrying the HD expansion, and hearing that they're negative causes really an identity crisis. Who am I? I'm not who I thought I was. And that might also make people feel that they've wasted their lives, that they went through their lives with the assumption that they were going to be positive, and now they're not. And maybe they would have done things differently if they knew they were negative. So we have to consider both positive and negative results. And this is also very important. If you have psychological issues, particularly some depression, not just sadness, but real depression where it's a struggle for you to get up in the morning, or you have a lot of anxiety, and both of these could be due to growing up in a home with HD. They could be due to other issues. They could be due to your fear of the future. But if there is significant depression or anxiety, testing could make it worse. Finding out that you're positive or negative could cause much more immediate anxiety or depression. So we really encourage people who do have some issues to think about therapy and getting support before they have testing. In the HD pre-symptomatic protocol, many of the HDSA centers of excellence and other places do require a psychological evaluation because we really want people to have the best outcome possible. But you can do this on your own too. So we would encourage you to connect with a therapist who feels like a good support system for you, and to do this before you get your test result so that somebody is in place for afterwards. And this is another thing you have to think about. Who are you going to give results to? And who wants those results? So one of my homework assignments to my patients is go home and talk to your parents or talk to your siblings, or hopefully they're going to share with their partner, but maybe some good friends, about whether or not they even want to know your results if you decide to test and if you decide to tell them. So it's easier to do this in a hypothetical way and say, I'm thinking about testing. If I do, would you want to know? Then later, when you have your test results and you're trying to decide, yes, no, should I? It is important to think about how those results would affect other people in your life, particularly your partner, but also how it will affect your siblings, and if you tell your parents, your parents. Okay, and the privacy issues is usually something that everybody brings up. And everybody should know that there is a law called GINA in the United States, but I'm really unsure about insurance coverage in other countries where there might be a national health insurance. But what happens to your privacy? So now with electronic medical records, if you go to see your doctor, your appointment will be listed in the EMR. One of the things you need to ask is, how is it going to be coded? How much is the doctor going to put in the record? And will my results be there? And we would encourage you to certainly get your results, but see if they can be kept out of your medical record, just in case. And that is an important thing, I think, because certainly there has been fear of discrimination, but in reality, there haven't been a lot of reports of discrimination. So GINA, the Genetic Information Non-Discrimination Act, prohibits any discrimination on the basis of genetic information or family history. And this would be for health insurance or in the workplace. And GINA applies to asymptomatic individuals, not to symptomatic individuals. And it does not cover long-term care, life, or disability insurance. And it also doesn't apply to the US military or veterans obtaining their health care through the Department of Veterans Affairs or the Indian Health Service. All of these individuals have different rules in their own health insurance. So one of the things that we encourage people to do before they have their genetic result is to think about getting all the insurance that they're ever going to want prior to getting their test results. Now, everybody can't do that. These insurance are expensive. We often have very young people coming in who really haven't considered any of this. And that's fine. We don't say you have to get it. But it's something to think about. And some people might choose to set up their own bank account, which would be their long-term care insurance if they were to get a long disease such as HD. So to sum up this predictive testing decision, some people are going to say, you think about this constantly. I want to set my mind at rest one way or the other. That's the uncertainty. But Alice Wexler, the sister of Nancy Wexler, wrote in her book about finding the gene for HD, Mapping Fate, which I really encourage you to read. She says, choosing not to take the test is a decision one can easily revoke, unlike the situation after testing. Once you have the information, you cannot give it back. Again, that's a really important thing to think about. And if you're not sure, it is perfectly fine to postpone your testing. So I am open to any questions at this point.
Hi, everyone. If you could submit your questions into the anonymous chat, that would be great. I think we have one already. Oops, sorry, hold on one second. Would you talk about the aspects of children after 18 doing genetic testing? And then how does someone find support if they tested positive without symptoms?
Okay, sure. Um, the other side of that question is, uh, what is the cutoff for genetic testing? The HD protocol for predictive testing has always encouraged people to wait until they're 18 years old to proceed with testing. Um, Certainly, if you have a very mature 17-year-old who has, really thought out all the issues that I raised, we don't automatically say you can't test, but it would be, very much on an individual basis. Post 18, some young adults are still very immature and have not thought very carefully about all the ramifications for their lives. So we look at each of these cases, again, individually. We are very careful with them. If it really looks like the person has been thoughtful and they are psychologically stable, we will test, but that support that is mentioned in the question is really, really important. So that support can be the family, that support can be mature friends, that support can be a therapist. Maybe there is a combination of all of those. So certainly the process for testing somebody that age is very slow. We certainly talk about whether it's the right time. Again, people have different motivations, but we would suggest that this young person does connect with a therapist just to support them afterwards. And of course, there are wonderful resources through HDSA and wonderful resources for youth online.
Great. Do you have a recommendation on just kind of like what is the first step? I know you went through a lot and maybe that was missed, but if you're facing this challenge, what's kind of like, where do you start?
Sure. I think the first step is to identify a center that has genetic counseling. And as I said before, you can come for genetic counseling and not proceed with testing. So, if you're just debating whether you're going to do it or not, you can still make an appointment with a genetic counselor. We'd go through the family history and experience of the person, their possible motivation, and the educational piece about the genetics of HD, and then talk more about how it affects that individual's life. And there are, no promises that that person is going to go on with testing. It's whatever is best for them. They might decide, yes, they want to finish the protocol, or they might decide, no, I'm going to wait for 5 years.
Okay, and one more question around, the length of time before you test. So I guess the question is around, if I'm thinking of testing and I have something in mind, like a time that I'm expecting to do something, like what does the process look like from a length of time, I guess?
Sure, and that is very individual as well. And it also depends on what center you go to. Some centers like ours are pretty traditional and follow the whole original HD protocol. Others have decided to do fewer sessions and do it a little bit faster. We feel very strongly that the original protocol is known to produce as good an outcome as possible. We feel it's very safe, and that's why we do it. So the entire protocol, again, is going to vary in time, but the first step is to call a center, connect with the genetic counselor, then you have an in-person or Zoom meeting with the genetic counselor, and most centers will really request that the person brings a support person with them to the genetic counseling. The next step would be a psychological evaluation. And the last step would be a neurological evaluation to make sure that there aren't subtle symptoms already. And then either blood would be drawn, or we are doing saliva testing. So a kit would be sent to the home. And it takes about 3 weeks after the kit is sent back to the lab to get results. And results would be given either in person or on Zoom, and again with a support person. So that part of the time span would depend on how ready the person is, and also on their psychological readiness. Sometimes our psychiatrist wants to have the person do some therapy prior to actually going ahead with testing. So very individual.
Okay, that's great. Another question around, someone just asked, is the saliva testing as accurate as blood tests?
Okay, good question. So yes, the only problem with the saliva test is getting enough saliva. So you have to follow the directions very carefully, but DNA is DNA. So if you can get enough DNA, you can do the test.
Great. Last call for questions. Anybody else? All right, I think those are all the questions we have. If you want to go to the next slide. Next and last. Well, I just wanted to thank you, Dr. Goldman. We appreciate your time. And of course, if anybody has any questions they didn't think of today, feel free to reach out to any of us or, Dr. Goldman herself. I'm sure she'd be happy to answer those questions, and Paula as well. We have the number for the COE on there. And I just want to let you know that we have our last summer series, which is wrapping up the summer on September 1st with Seth Rotberg, who's going to talk about patient advocacy. He is awesome, and if you've been to any of the national conventions, I'm sure it's a familiar face and name. And then just let folks know, if you didn't know and you're interested in joining, we have a live virtual Team Hope Walk for New York City that we're running on September 12th. So we've got a busy September, and hope to see you on our next summer series. So that concludes the session. Have a great day, everyone.